So may I ask George and Bill and Leanne to sit up at the front for this last discussion period? While they're gathering, I want to share with you a thought that David Butler scratched out and passed over to me. He wrote, "Risk communication professionals are good at communicating information about risks." Who would have thought? Thank you. So, as if it weren't complicated enough, what you've conveyed to us this morning, I want to start with a question, but begin by making our lives more complicated and sort of ask your opinion about how what you've taught us about this morning might apply in the broader landscape. So it wasn't exclusive, but the real emphasis of the presentations was on communicating from to individuals in the public. And but if we think about the system that we're concerned about, we have kind of overlapping spaces that have hierarchies of richness and complexity of stakeholders. So the built environment has architects who design the buildings and engineers who design some aspects of the buildings, and the manufacturers of things that are used in the buildings, and the owners and the occupants and the agencies who have different kinds of responsibilities for different aspects, and the professional associations who are ensembles of some of these groups. Not to mention the government agencies that have different kinds of responsibilities. And then we have layered on top of this, because we're concerned about health risks or intersecting with this, the healthcare provider stakeholders. And I won't bother with the long list of various groups here. So how do the messages of, at some level, individual action at the individual person level matters a lot to what we're concerned about on the exposure side, on the health risk side. Maybe it's appropriate that we focus there, but a lot of what can be done requires action in these other places of engagement. Does what you taught us this morning change radically if we think in the broader landscape?
I don't think it should. I mean, I think that these would be audiences that you could tailor your messages to based on their competing um, responsibilities. They would also have sort of a cost benefit analysis that they would go through, just like an individual citizen would. So I think a lot of what we talked about would I mean, they would also have competing risks that they would compare to this particular risk. I would see it would be the same approach. It would just be treated as a unique audience, if that.
And I just say, I think one of the things that was important, this came out a little bit yesterday, is this idea that one of the groups that you want to communicate with and perhaps get this kind of upper in top of mind, for example, are people who are thinking about standards and things that end up influencing each of, whether it's appliance manufacturers or architects or people making building materials. There are other avenues to make progress here besides just putting the entire burden of both learning, understanding, and then acting on individual homeowners, as you said. So I think that's a really good idea to think about some of the other audiences that are out there and other leverage points besides just trying to get individuals to change everything.
So I somewhat disagree. I think that those are different conversations. It's not different messages, it's different conversations, it's different questions um, of those particular stakeholders. So it's not simply a different message to deliver to them. It's, as you were suggesting, understanding their particular needs. You know, a policymaker's needs or a regulator's needs are going to be quite different than a homeowner's needs. The information that they're going to want to have is different and at a different level. So I think it's a different strategy with those particular audiences. I think we're saying, maybe I don't disagree, maybe we agree completely. We're just saying it in different words. So.
Okay, let me thank you for the responses. Let me open the floor to people here. Bill?
Bill Fisk, Lawrence Berkeley Lab. It seems like given the invisibility of particles, maybe we shouldn't try to communicate about particles, but about, sources and filters and, cooking and range hoods and better filters and, the tangible things that people can see and do something about rather than particles as a generic topic. So.
I think back to some of the things that Bill talked about, that's a really good idea, but you've still got this first level thing of saying, why should I care enough to make either the investment of time or inconvenience or something that's going to change my life to address this? And at some level, it's got to be, maybe it isn't particles, maybe it's indoor air quality, maybe it's something broader, but you've still got to have something that says, before somebody's going to do something, they've got to say, so what, or why? And that's part of the challenge here, and it goes back to this invisibility issue.
Thank you all for great talks. I have said in the last couple of days, including today, kind of off the cuff, that I thought it was very important to have epidemiology that addressed countable health effects, heart attacks, cancers, whatever birth defects, whatever we're looking at, that was important to people's understanding and the regulatory community's success in promulgating regulations about indoor air quality. Do you, from a risk perception point of view, or any point of view you like, do you agree with that? Is that really important, or can we continue to do risk extrapolations and calculations based on what we know in ambient air? Do we need real data from indoors of health effects?
Yes.
Also want to thank you for great talks. I really particularly appreciated the points Leanne made, that before we can start crafting the message, we have to understand our audiences and where they're coming from. And I think we intuitively try to do that, but spelling that out was really helpful. I didn't see a lot of discussion about the precautionary principle. So in the face of uncertainty, sometimes the idea that knowing that something could be harmful for me and I have an easy way to reduce that risk is compelling, I think, to people. And I'm just curious if you had any thoughts about the possible role of that frame.
I think it can be really helpful. The problem, or at least caution that one would have to have, is that you have to be very careful that the media then take that and don't make it a certainty. And so once that happens, then I mean, nobody said that red wine was absolutely bad for you or absolutely good for you, but that was the story that people heard. Turns out it's good for you. So there has to be really careful construction of that so that it ends up getting to the recipients in the form that you intended it to be, which is just, hey, this might matter. It's really hard to deliver that.
So it's an interesting thought. I mean, we've been talking around this table almost as if we've adopted the precautionary principle. I think the assumption around the room is that exposure to PM is not a good thing pretty much at any level, and that we should try to reduce it. Unfortunately, in the United States, we don't actually regulate based on the precautionary principle very often, and when we try to do that, it's called government overreach. Whatever the EPA says can and will be used against it. I think we see that over and over again. So I think we want to be careful in how we frame these particular messages. I don't disagree that I agree that we should be trying to reduce exposures, but maybe not on the precautionary principle.
And I just want to add there, this is something, it came up a little bit yesterday in the discussion, in fact, in Bill's provocative question to everyone. When you talk about being precautionary and saying there's something that could be a problem, here's something you can do to prevent it. Not everybody can do it. And you end up with things, and then you create this situation. One of the ones that I look at, and I remember doing this because when we were having kids and reading What to Expect When You're Expecting. Everybody gets that book when you got kids coming. And it talks a lot about how you should buy organic food. to be precautionary. Not everybody can buy organic food. What are they doing to their babies? What are we telling people? And so I actually am someone who is less comfortable with an approach like that and would rather be back at Howard's point where I know that there's a problem and I've got a good idea that this is a big enough problem to really work to persuade people. And that's when we should be engaging in all of these different ideas that we've talked about.
So that brings up the issue of the mommy mafia, which I didn't get a chance to talk about. Um, So, and social norms, which Leanne, this is another way of talking about this. And as somebody who actually does work on public perceptions of GMOs, I'm quite familiar with the sort of social pressure to buy organic, to avoid GMOs, pesticides, and those kinds of things. And if you don't have the resources to to engage in precautionary behaviors about that or anything else, all you're left with is feeling bad. Guilty that you're a bad parent. So because we have a particularly vulnerable population in young children, if you don't have the resources to deal with it, are you a bad parent? Well, so the other thing I would say is that one of the problems with the precautionary principle is that there are lots of things that we could prevent, but we need to do a kind of risk um, prioritization process. And what I was trying to get to yesterday is sort of where does this fall in that set of priorities?
So we have a few more questions queued, and then I see Paula and Vito who will be queued up after a web question that's come in the meantime. So I'm in 5 coming up. Brent.
Okay, thanks. I don't quite know how to phrase this question, but it kind of cuts across the last 2 sessions. The 3 good risk communicators we've got up here have just seen a lot of data over the last day and a half. Some of these data are things that we know for outdoor pollution, and they're largely relative risks. They're, you know, 10 micro, and they have technical quantities and science-based quantities. 10 microgram per cubic meter decrease in PM 2.5 yields a 0.6 year increase in life expectancy for the population. How do you communicate some of these things? Relative risks of 1.03 in a study for birth outcomes. How do you translate that? How do you communicate that? Maybe how do the epidemiologists communicate? How would you communicate it? And do the magnitudes, how important are those?
Sadly, Americans are really bad at numbers. We have a difficult time with very large numbers. We have a very difficult time with very small numbers. Parts per million, parts per billion, nanometers, microns are completely meaningless to most normal human beings. And by normal human beings, I mean people who are not at this table, right? We are not normal. I think we should accept that, right? It's important that we be able to communicate with each other using that particular scientific information. It's a shorthand, but it serves to actually alienate the public. And so I think we should spend, so in a way that's the wrong question. It's not how can we make them more like us and give them more expertise like us. I think the question is how do we actually become more like our audiences and talk to them at a level, we talk about fine particulates. Is that a good particulate? So, and I'm sort of, I'm using humor to sort of illustrate this, but intuitively speaking, we were greeted 2 mornings by people out front who referred to this meeting as particular matter. Oh, you're at the particular matter meeting. Well, yes. So we need to think about what our words actually mean intuitively to people. So.
Mark, one last.
So first, very nice presentations, and I want to thank you, Bill, especially for now giving me something to go back to my wife with to say why I'm drinking the spoiled milk and the moldy salami. So it has nothing to do with the microbes. No.
Now you understand why you're wrong.
Exactly. Now, so I wanted to ask a little bit on the personal behavior change. And this is to everybody. The sort of ethics and success of dealing with things that people see more immediately. So on the health side, if we think that maybe particulate matter has a little bit of influence on your level of energy, being tired, something that probably people, every day will feel like, geez, I wish I had a little more. Obviously, if particular matter had nothing to do with that, it would be kind of unethical to say you ought to be concerned because it's affecting your energy level. But if it has a little bit, but a minor thing, but it's something that they think about every day, I would think people would then start to act on that more. But is that not fair to sort of piggyback on that, even though it may not be the primary driver, but it is something that people see every day and feel like, geez, if I could do anything to just get a little more energy, I would do it.
I feel like we need to keep reminding ourselves when we throw this out there that we should be picturing what do we expect they would do with that information. So literally, what would they do with that information?
Well, I'm thinking, if you're trying to say, yeah, I understand in terms of buying a filter or something might be too
Yeah,
expensive, but
yeah.
if you have some thing you can do in terms of even thinking about how you ventilate your stove or something like that, obviously cost is going to come in, but in terms of reasonably easy things to do that could be done cheaply, if you're trying to get people to actually act on it, it would seem to me that they're going to be more likely to do that if it's something that they see every day, right? Even Parkinson's disease, maybe are they really going to care that 60 years down the road somebody might, have this and it's pretty rare versus, every day I wish I wasn't so tired at the end of the day.
I would say one of the things you have to be careful about that there, and we see this even with things like it's not immediate, but it's with outdoor PM. We're looking at a small contributor to a big thing. So if you look at heart disease or something like that, if you're a small contributor, and I'm going to get immediate feedback, I just put that damn filter in, and I still feel like crap because there's all of these other things that are influencing me. It can actually kind of hurt the credibility. And something both Bill and Leanne brought up that's really important is the credibility of the message. And you can lose that with people really easily. And that then makes it harder for you to get anything through. And so I'm not saying it's wrong that it could be contributing, but if it's a small contributor in a very complex mix of things, it's a hard and our public health contribution our calculations tell us this is how many disability adjusted life years are being lost here. It's still got the potential to backfire when it's used in communicating with people when they get feedback.
I would add, because there is this lack of feedback loop, I absolutely agree with George. This is problematic. Ideally, what you do is you make PM the next gluten, right? And sort of carry that. The other thing that's worth saying is that if you can convince people that indoor PM is a problem, and there are multiple sources, people will often pick and choose. My guess is that they would pick and choose which sources they would reduce. So one of the things that we know from nutrition is that people will engage in a kind of indulgence model. So I currently have an apple in my coat pocket, which I will eat on the train, which will enable me to eat the bagel that I already had for breakfast. So I'll make small changes to avoid making kinds of other changes as well. So, I didn't change my vent out, but I don't burn candles, or I burn candles, but I put the vent on, and so they sort of do these kinds of intellectual trade-offs. Yeah.
Let's take a question from the web.
Okay, if you'll give me just a moment to cue this up. This is a question from Tom Phillips. He writes, the limiting factor for air cleaner effectiveness in range hood use is probably human behavior, especially in homes. In a Detroit study, low-income persons with an asthmatic child were provided with a free HEPA air cleaner and filter replacement, but their usage dropped off greatly after a few months, even with visits from researchers. Any suggestions for improving persistence or compliance of air cleaner and range hood use?
Make them automatic. Fundamentally, it has to be the default option, where people would have to either turn it off, and whatever those filters are also have to be livable. So they can't be the loudest, they have to be livable. You have to be able to live with them. Otherwise, people will turn them off. And if the default is a loud fan, then people will actually disable those particular kinds of devices. So we have to be, one of my slides, people were saying this yesterday, we need to be holistic in our approaches to interventions.
Paula.
Is it just both of the talks were outstanding. Is it possible to
Paula, you have to be on the mic because we have a web.
It's not, all right. Great talks, I learned a lot. Thank you so much. Is it possible to frame some of the interventions we've talked about, whether it's the ventilation, the filters, or just like around, you'll have a healthier home or a healthier family, or does that just, you know, take us down the wrong pathway?
I think that can be useful. One of the things I wanted to say before, and I think it's relevant here too, is that when you put a risk factor out there, it's going to be amplified as it gets communicated. And so suddenly it becomes the thing. And so you need to pick carefully what those risks are that are going to get amplified and become a topic of conversation and a topic of concern. And so yeah, the message of you can have a healthy home is good, but there's the front end of it, and what is it that we told them they had to do or that matters that contributes to that healthy home? And so I keep wanting to push us back to, so what is that we're willing to put out there and let it take on a life of its own? And I'm not saying that we shouldn't pick anything and do that. I just want to be really cautious because these can take on a life of their own.
And I'd want to do this in a careful way, and I want to endorse something that Bill talked about a lot, is this idea of mental models, which is understanding how people think about things. Because one of the other important things about that is understanding, it's the Mark Twainism, those things that you know that just aren't so. And Bill showed us great examples of that, where people think that doing certain things is making their home clean, and we know that part of what they're doing is actually bringing in sources. And so it's to do that, you'd have to really understand how people think about those risks, what they, and then be pretty careful and pretty mindful about how you use that word healthy. The other thing that's a little bit of a problem there is, and this hasn't really come up, but when we're talking about all of the stakeholders who are involved in this issue, they're going to be winners and losers. You know, there are places where we're going to say these are things you shouldn't do, and there are people who don't want that message to go out. So you've got to be really careful about how you engage in these things and the information you have, and the ability in some ways to fend off other sorts of information that's going to come from people who have other points of view.
So in 2 weeks, I'll be back in this building for an NAS workshop on the science of science communication. And what I want to underscore by that is that there actually is a science to this, and that's the kind of messaging we would want to test. We would want to do the mental modeling work. We would want to figure out what people's starting points are. We would want to be able to test messages and figure out where that leads them, and then what other questions that actually gives rise to. So that's the kind of research agenda we really need. We need more than, you know, just a couple of studies. We need programmatic research in this particular area. And, you know, interestingly, EPA was the initial leader in the federal government on risk communication. So I look forward to it taking a leadership in this particular area as well.
Vito.
Vito Ilacqua, US EPA. I'm going to be a little contrarian in this session that is about risk communication, because I don't want us to focus on this as the only solution. And building a little bit on the question from the web, I mean, we heard we are not normal people, and it's true. I care about things such as the drop in the filter efficiency or the amount of organics in the indoor PM, but you walk a block from this building, it's going to be hard to find someone who does. And yeah, even for me, I think at home, I remove carpet only from one floor. I have a filter of unknown rating that I don't know when I changed it last time. And you don't want to know my heuristic about whether to turn on the kitchen fan or not. So I'm, you know, we are in here, we are as educated as we will ever be, but I'm not the only one in this situation, listening to conversations during the breaks. And so maybe one of the other avenues to pursue is what Bill actually just brought up. If we add a system that does that for me, I don't have to think about it. Turns on ventilation with the outside by measuring indoor and outdoor, something that we are good at, say particle number, and turns on the kitchen fan or filters as appropriate. That the same way as a thermostat works with my heating system. Now that would be something that can be used, and yet I wonder if I walk in a 20 or $30 million home, would I see a system like that? And I don't know anybody in those circles, but my guess is probably not. And if not, why not? Because I mean, we think, and we have a reasonable reason to believe that this stuff is bad for your health. You don't want it. So in places where resources are not limiting, why are we not seeing these devices? And this is my last point. I bring up these 0.1%ers deliberately because everyone wants what they have eventually, right? And think about it. A thermostat at one point was a luxury item in a home, right? And there's a lot of very good reasons to focus on the low end of the socioeconomic status, but maybe some investment also at the high end is useful, and we might get some traction in this public health issue.
People who own $30 million homes and display kitchens don't typically actually cook in them. They make reservations. They don't make food. But I take your point, and somebody mentioned yesterday the Internet of Things. I think there's a lot of possibility to work with stakeholders to develop exactly those kinds of things, cheap monitoring devices that will make the invisible visible, that will turn things on for us, even when we don't intend to do that, or perhaps turn them on when we're not there. So my thermostat drops automatically. Why shouldn't my HEPA filter go on and do a couple of changes for me before I come home from work? I mean, these things are possible. They aren't necessarily all that expensive, and with some research dollars, who knows? It could happen.
But they would start out expensive, right?
Yes.
The first versions of them would be very expensive, and then the early adopters, which would be the people who can afford it, will work out the kinks before it makes its way down to the cost-effective mass
Yes,
distribution
absolutely.
model. So
No, absolutely.
So I have to do, David, you're on my queue, number 4. I have to do a small reality check here. I'm committed to having us finish at noon. This session, there was like 10 minutes of closing remarks. I don't have anything to say, so we can save that 10 minutes. Brett wanted to have a few minutes, so we'll try to fit that in if possible. I have 5 people waiting to ask questions right now, and I've forgotten the order. No, it's Barb, it's Rich, it's Getty, and David, and no, it wasn't you. Who was 5? Bill Fisk. You did? Oh, well then you should be 5. Bill, you're 6, and that's the end.
Barb Turpin. And so I wanted to ask you about data visualization in real time as a tool for getting people to change their behavior. And so I'm going to ask that because I'm thinking about myself, and I do feel more bad today about my own behaviors. So thank you for that. But the example being people who drive let's say a Prius, where there's data visualized in front of you about your driving technique and how it affects your mile per gallon, your fuel economy. That has an impact on people's, makes people change their driving behavior, their techniques. And I would think that the same would happen for people like myself, the people in this room, if you're seeing in a graphical way, in a visual way, when your particle concentrations increase and decrease in real time in response to what you're doing in the house. And I don't know if that works for everybody else.
That's a great one, and I'm going to give an example. Unfortunately, this is actually a paper I assigned, but I cannot remember authorship or anything. But this was a case at a university where there was a competition to reduce electricity use between dorms. One dorm got its electricity use feedback weekly. The other one had it in real time. And even though they were both trying to reduce it, the one that had the real-time data was 20% lower than the one that didn't get the feedback. And it really is this idea that when you see the consequences of actions you take, it can really influence behavior. That's a really interesting idea.
So if it's any consolation, Barbara, I'm concerned about your behavior as well. Barbara's a colleague of mine from Rutgers. Sorry. So I'll take you one step further. There is some evidence from energy use and climate change that if you give people social norm data, so here's how you stand and here how your neighbors as a mean stands, and you're way above the mean in your energy use, that can also motivate changes in behaviors. So, and that's possible with the Internet of Things. And creating anxiety, yes, yeah.
So my question relates to not necessarily communicating to the public, but where the public can get reliable information sources. So there's a number of people I'm sure in this room that have given presentations to the general public about indoor air quality. And one of the questions that we often get is, what are the things we can do to make the indoor air quality better in our homes? And I can tell you, when you go through the list of all those things, that the public really grasps on to candles. Candles is something that they listen to when you say it, and then ion generators is probably a distant number two. But the follow-up question is always, where can I get more information? And there are some good information sources out there. The EPA has a website that has some good information on it. The California Air Resources Board has information that's incredibly hard to find, but it's good information if you can find it. So how important are those information sources, and how does the public perceive the importance of getting to those sources, or perhaps getting the public to realize the importance of those sources?
I think it depends on what the first touch point is for the learning when they realize they want to know more information. And so it's all going to be dependent on who that original source is. So if it's you, it would be natural for you to say, oh, hey, I know there's a website, the EPA has a website and you can go to this for more information. If it's a pediatrician, and they've got individuals in their office from lower income areas, and internet access might not be, you know, across the board there, then there's going to have to be other tools. And one of the first things they're going to do is hand people some kind of a pamphlet, right? And so it's really going to depend on the context, and it's going to depend on what access to information people have. So we can't really sit here and give you one list of, okay, it's got to be this, 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 and this, because it really is going to depend on the audience and who that originating source is for that information.
I would say those sources are extremely important. I think starting points, as Leanne was saying, are extremely important as well. Generally, we know that when people are interested in health-related information, they typically go to the internet. So one of the things we need to be checking is, what does Wikipedia say about indoor PM? I have no idea. What does WebMD say about so these are sources that people typically use, and we want to make sure, we want to sort of police.
Rich is going to find out for us in real time.
We want to police those particular sources to make sure that the information is good and the links are live. I don't know that people think, oh, I'm going to go to the EPA website as the first thing. I sort of doubt that. There are important social media sources. I mentioned the Mommy Mafia. In the food world, the Food Babe, for example, has a lot of sway with young moms. Yesterday, I tried to register the name The Dust Whisperer, but apparently that's already taken by a Swiffer mop or something.
Yeah,
like
yeah.
That. So, but actually creating a site like that sort of intuitively makes sense. The name makes intuitive sense. Would actually, I think, be useful for people.
Thank you, Getty.
Hi, good morning. Getty Moinelis from Rutgers. Wonder if you could comment on communicating positive news or perceived positive news so that this message would not backfire. And let me give an anecdotal evidence. We did a study in a green building, and we asked people, residents, how they perceive the green building. And quite a few of them said, what kind of green building is this? Look at my electricity bill. And we asked them, why do you think you'll try to investigate why this bill was so high, quite above average? Well, because they had number of high energy use plasma TVs, number of computers that was way above the average, but their perception was, this is a green building, I can have all these appliances that would not hurt my electricity bill. The question is, how do we communicate something that's an improvement so that people's behavior would not negate that improvement?
Yeah, the idea that I've put in ionizer, I've put filters in my home, so now I can smoke inside again, right? Right, and there's very real examples of this from all people. If you ask people how many calories do you think are in this hamburger, you know, they'll say 500 on average. Here's the same hamburger plus a salad. How many calories? And they'll say 400, because somehow there's this halo effect from the good thing. No, and that's a real problem. I don't know if I have an answer to that.
There actually is something called the risk homeostasis theory, which kind of addresses this. I refer to it as the indulgence model, but people sort of have a baseline sense of how much risk they're willing to take or how much energy they're willing to use, and so reductions in that will lead to other riskier behaviors. We know a lot of that about that from traffic studies. So people will put on snow tires and then do donuts. David, I'm looking at you, because they have greater perceived control. We were talking about this last night. People will buy SUVs and drive like idiots because they believe that they're in a tank. So, yeah, it's risk compensation essentially. Yep.
David.
David Rouse at EPA, and I'm going to mix a little appreciation for the work you're doing here with my question. I think we are going to be counting on this panel to lay the foundation for not only some work from us, but from a lot of different organizations, we hope, on indoor PM. And what people will do with what you put out is think about what behavior changes they want to try and promote in lots of different audiences. EPA typically does that through regulations where we say this is what you must do, and some people comply and some people don't. In our non-regulatory indoor air program, we put out here's what we think you should do, and some people comply and some people don't. What will happen with this report is we'll point to it, and others will point to it as here's the technical, scientific reason why we're trying to get architects or building scientists or people living in their homes or engineers to do something different, some behavior change. And so this part, the risk communication component of this, is a real important piece because it sensitizes everybody to the fact that the translation of what we know scientifically to what we say to people about that is very important. And Bill, you mentioned EPA used to be at the forefront of this. I helped get the radon program started, and that was a big piece of environmental public health risk communication. And the things you're talking about are helpful. Could you just reflect for a moment on the difference in how you do risk communication around a non-regulatory issue where you're promoting, encouraging, suggesting behavior change versus a regulatory issue where you're quote unquote requiring it and expecting compliance?
Was that addressed specifically to me?
To the three of you, the three panelists.
But you want me to take the fall. So they require different strategies. So I've done health promotion work in the past where you are cajoling people, you are providing information about the particular benefits that they will gain. There are different framings that one can use to try to encourage behavior, gain frame versus sort of loss framed. You can use the kinds of social, what's the word I'm looking for? Social norms, thank you. Social norms to encourage those behaviors. You can try to create feedback loops for people. That's real different than having regulatory power and essentially saying you can't do something unless you do this. You know, one of the slides I actually took out because I knew I would be close to my time was you need to be realistic about what risk communication can actually accomplish. You know, if you can get this idea that PM is a problem, indoor PM is a problem before 10% of the American public, if you were in a private, you know, advertising agency, you'd be getting bonuses. If you could get 10% of the market at anything, you'd be getting, you know. So the idea that we're going to encourage 90% of the public to do something simply based on the things that we say is a little unrealistic. which is why we need things like regulations. I mean, you know very well that, you know, radon, getting people to test for radon, at least in the state of New Jersey, required stakeholders to insist that radon tests be done before people got mortgages. There was no way to cajole people to test for something that if they found they had a problem in their basements, it would cost them several $1,000s to do something about. We have a sort of a similar issue here. If you think that you have a real problem with PM, then it's on you to do something about it. That's a pretty tough sell.
So our last question, Terry, if you still want to.
Thanks, Bill. And I would like to go back to your introductory comments for this part of the session. And I have some experience with some of these issues. In the 1980s, I was building single-family residences. We put kitchen range hoods in all our houses. We violated the manufacturer's warranties by wiring thermostats into the range hoods so that they would come on automatically. And whenever we had an air handler in the building, we used, in those dim days, would have been an ASHRAE dust spot efficiency, a 30-30 bleeded filter, so we had improved filtration. So those are things that we've known how to do for a long time. That was easy for me to do because as the builder, I had lots of control over what went into the building. It was an easy sell to the owner because it was like, well, Linda, you cook every night. You're getting these exposures. Bob, you'd like to change that, wouldn't you? So that was pretty easy, and it helped that it came in stainless steel. So that was an important part of the sell for making that change. I have done building forensics for home builders who build 5,000 houses a year. When we make a change with those owners, we change 5,000 houses a year. That's a big improvement. I've been on ASTM and ASHRAE committees for these 30 years, no more. And that's why I look like this from the committee work. With ASHRAE 62.2, I've tried to get kitchen range hoods required since 2000. It's still not required. It's always an option for us there. And at this point now, because of the LBO work on the dollies, we've been able to propose a change that will give some credit. So there's a trade-off option in there now. And sitting around the table are in fact other parties who are going to lobby against anything we do along those lines. At all the committees are like that. So those make so the arguments, the persuasion, the things that work, it's sort of like a wrestling match. It depends on who's in the ring with you, what tricks you're going to use. And I think that's the point that I wanted to make here. It's where you started, Bill, with there's all these other parties involved. We're all making decisions that can affect things at a policy level or at an individual homeowner or renter's level. And each one, you have a different hand to play for each one. And I urge us to think in terms of that complexity. And for the trades, it's, you know, like if you install it the way I want, there's a case of Jack in it for you.
So we've reached the end of our time. I'll give you three the opportunity to say any last word that you'd like, if you care to. I just have a few summing comments.
So I would agree with Terry that that there are different conversations to have with different groups of people. And it's not just what cards they believe they hold, it's what cards they think everybody else holds as well. So in changing policy, for example, we know that policymakers care about what it's not what people actually think, it's what the policymakers think the public thinks that actually drives policy. So getting some of the data that Leanne is talking about might actually help make
Very
that
important.
persuasive argument with a regulator or a policymaker. But we need to be strategic about those particular conversations and meeting those particular needs. Absolutely.
And that was a case of Jack?
Yeah, are you interested?
Well, Rich reports to us that Wikipedia in its current version, anyway, is not the answer. We have some work to do there as well. Yeah, no, we could. I mean, anybody can be an editor, right? So we've reached the end of a remarkable day and a half. There's a cartoon that one of my colleagues used to show to students. It was from the Far Side, I think, and it was like, Mrs. Smith, may I be excused? My brain's full. And I feel a little like that. I want to thank, again, everybody who has been engaged in this effort. I've done it already, but I think it's worth doing again. The committee that worked with me of colleagues, Howard, Tina, Terry, and Rich, thank you very much. Institute staff, unbelievable. David, Guru, Anna, you know, this doesn't happen without a huge effort, and we really appreciate that. EPA that sponsored this, now we have to sponsor a full study, right? Really outstanding group of speakers. You collectively exceeded my expectations, and those were high. So thank you, it was terrific. And the audience, people who are here, and the people who hung with us for all on the web. Really, thank you all. It's been a great day and a half, and quite worthwhile, I think, in many dimensions. So I've said all I'm going to say.
And thank you, Bill.
Yeah.